Hi, I'm Vanessa and I'm actually a doctor and I also have been a nurse for a considerable amount of years. One of the companies that I have set up is a company called Healthy Hedgehogs, and one of the reasons for setting that up is people were always asking me about information, and they also wanted to know a little bit about the products that were available within healthcare and didn't always want to talk to their GP. I think it's important that any problems that you do have, you do discuss it with your GP. However, I'm happy to point you in the right direction. There are lots of resources for most healthcare conditions, but what I'm going to chat through today is about heart disease. Lots of people ask me about heart disease. Interestingly, it's a collection of diseases, so there isn't a simple answer for what constitutes heart disease, but what most people associate with heart disease is angina, or actually having a heart attack. So what are the causes? Why would you get those problems? And the reason that you end up with narrowing of the arteries is because you get a sort of fatty plaque deposit within arteries, and that actually narrows the blood supply to that particular organ. So if your blood is reduced, or your blood flow is reduced to your heart, you get angina. So you actually get a cramping of the heart, and you get a sensation of tightness and pain in your chest. You usually find that it starts when you move around and are doing things, and if you're still, it'll subside and go away. And obviously, if that gets to the point that there is no blood supply to the heart, or the heart can't get enough blood, you have a heart attack. And that's a permanent problem where a little bit of the heart muscle dies because of the fact it didn't have a blood supply. These actually are a combination of illnesses and diseases called cardiovascular disease. So you can have narrowing of the arteries in your brain, and people that have those problems could have a stroke, and you've probably seen on the television, you know, the symptoms of a stroke where they talk about one-sided weakness, or the drop in the face, not being able to speak. And sometimes not having enough blood supply to the brain can also lead to a sort of vascular dementia, where you're actually finding that you're starting to lose your memory, become forgetful. The other type of hardening the arteries that a lot of people are familiar with is hardening of the arteries to the legs. So they'll have pain when they're going up hills, for instance, and again that's because of the narrowing of the blood vessels in the legs, and they can't get enough blood supply to the muscles, and you start to have a cramping sensation when you're trying to do things, and again it subsides when you stop. You can also have a minimal blood supply to lots of organs, so your kidneys, your eyes, all sorts of things, and that does have an impact on how your body works. So that in a nutshell is, you know, the hardening of the arteries. What causes it is this plaque, this fatty plaque formation. And then what we're going to talk about next is risk factors to do with heart disease and cardiovascular disease.